In this section, I will go over conducting preference assessments. There are different types of preference assessments that can be utilized to find valuable reinforcers for clients. On the next slide, let's discuss conducting preference assessments. When conducting preference assessments, it is important to determine what items are the most preferred for your client in order to help increase the motivation for your client. A preference assessment is used for identifying potential reinforcers for the client. What is so important about reinforcers and why do we need them? Reinforcers are utilized to help with skill acquisition programs as well as behavior reduction strategies. Some of the different ways we identify potential reinforcers is asking the client the certain things they like or prefer, free operant observation, which we go into more detail about, and trial-based methods. So you might be saying to yourself, what if my client isn't able to tell me what reinforcers they prefer? It is super important to know the verbal level of your client and their ability to answer questions. Some of those questions might be, what are your favorite games? What are your favorite toys to play with? These are the types of questions that you could ask your client to narrow down some potential reinforcers that will best fit your client's preference. Next, we are going to talk about free operant. This is where you could observe your client within their natural environment and record what items the client gravitates toward and engage with. This is an observation where the client can freely access any of the appropriate items in their environment. During your observation, let your client freely interact with the toys or items in the room to see which ones they show interest in by gravitating toward those items and engaging with them. Pay close attention and record the duration of interaction that your client has with each toy or item. It is handy to keep a stopwatch or timer on you so you can accurately record the duration. Sometimes, when assessing clients using free operant preference assessments, you may not be able to identify those potential reinforcers, and that's okay. That just means you need to utilize other assessments such as contrived free operant or naturalistic free operant. In the next slide, I will discuss the difference between the two and why they are helpful. If you have to use contrived free operant preference assessment, you will set up the environment with a number of items that the child can engage with versus having the client freely have access to anything and everything in the room. Maybe narrowing down some of those items can give you better results on what items or toys can be potential reinforcers for your client. And same thing, the RBT will record the duration of each engagement of the items or toys the client chooses. For naturalistic free operant preference assessments, it is sort of the same as a normal free operant assessment, but the difference with it being naturalistic. You're going to use the client's natural everyday environment, such as their home, their school, etc., places that they are familiar with. They might be more variety of items or toys that the client may draw attention to. Once your client begins to interact and engage with the toy or item, begin recording your durations. Next, we are going to discuss the three trial-based methods, which are single stimulus, paired stimulus, and multiple stimulus. A single stimulus preference assessment is when the observer provides one single item to the client and observes their interaction with that item. You're going to want to use a variety of items to use one at a time. Each time you present an item, that is considered one trial. You are going to present each item till all items are presented or when the client begins to deny certain items that are showing less preference to. We want to be able to observe and identify the high and low preferred items for our clients. We use single stimulus preference assessments to clients who have a hard time choosing between high and low preferred items or toys. Paired stimulus preference assessments is when the observer will present a pair of items or edibles to the client and allows the client to make a choice from these options. Once the client has chosen an item, let the client play or interact with the item or consume it if it's an edible. Just as a side note, make sure you know your client's allergies before giving them any sort of edibles. After a few seconds or so, make sure to record which items were chosen and how many times they were chosen. Continue repeating the trials with those items or change them and use different pairs of items for the client to choose from. Once you have recorded all the items chosen, rank each item from the most preferred to least preferred. Here is an example of what a paired stimulus preference assessment would look like. You want to make sure you mix up the pairs to see which items are chosen over others. Next, multiple stimulus preference assessments are when the observer will place an array of 6 to 8 items in front of the client. The observer will instruct the client to pick one out from the array. Let the client engage with the item and record data on what item was selected. The observer will rearrange the items and represent the trial. When assessing a client using multiple stimulus, the observer will set an array in front of the client with 6 to 8 items and will instruct the client to pick one. The client will select an item from the array, allow them to engage with it, and record which item was selected. The observer will keep the selected item in the array and replace the unselected items with new items. The observer will then repeat the trial with the selected item and the new items in the array. After doing a few trials, the observer will rank each item from highest preferred to least preferred. Now, multiple stimulus without replacement is the same as multiple stimulus with replacement. The only thing different is that the observer will remove the item and not replace it with another stimuli. The observer will continue to represent trials until there are no more items left in that array or until the client stops responding.